Hi, I am Sam Garner and I want to talk to you about stress. You may have heard of it and you may have experienced it. Okay, who am I kidding? Of course you know what stress is and you've probably experienced it in bucket loads. Life is stressful and your job is stressful. As always, I'm not going to tell you what you should do about stress. That's not my approach to mental well-being. I'm going to talk about several theories to help with managing stress so it doesn't have a negative impact on your physical or mental health. Pick what you think will work for you and work at putting it into practice. As with all mental health techniques, the key is that they need practicing to become habit, and we need to make sure we are proactive with practicing them. So let's start by looking at what is stress and why do we have it. When we're placed under pressure or we have demands put on us, it's our reaction to being threatened. Our body reacts by releasing hormones that make us more alert and increase our pulse rate, which enhances our performance in the short term. So some stress is a good thing. What's not good is when we experience longer term stress. So many of these stress hormones have a negative effect on us physically and mentally. They damage our immune systems and can lead to a whole host of physical problems. Physical problems of stress can include IBS, irritable bowel syndrome, forgetfulness, aches and pains, headaches, unable to focus, lack of energy and tiredness, increasing use of alcohol or drugs, or changes in eating habits. Over longer periods of time, stress can cause high blood pressure, heart disease, diabetes, depression, anxiety, skin problems, and many others. Stress can also make existing problems worse. Pain feels more painful. What also happens when we get stressed is that it leads to changes in our behaviour. We may become more anxious and struggle to sleep, be more irritable and angrier, all normal reactions to stress. It can also twist our thinking processes. When we are overstressed, we are more likely to jump to conclusions and personalise behaviours. We think people are doing things to annoy us on purpose. It's like when you're late for something, there seems to be more useless drivers getting in your way on the road. Or when you're in a rush, the family seems more troublesome and less willing to help, and that makes us even more angry. When I'm stressed and I've been neglecting my mental health, I absolutely despair at the inability of people in my household to see simple things that need doing and putting away. It feels like they're doing it on purpose. The problem is they aren't really that bothered if I'm angry at them. They know I'll shout at them, but they know that's about it and that it will pass. I can't change their behaviour, but I can change mine. Now, one theory around stress I want to talk about was developed by two people called Lazarus and Folkman. And they have a definition of stress that I really like. They say that stress occurs when we have a demand placed upon us, but we don't have the resources to meet that demand, or we think we don't have the resources to meet the demand, that we aren't going to be able to do it. They also said that how stressed we are isn't affected by how far off we are from meeting the demand. It's affected by what we think will be the consequences of not meeting the demand. So if we catastrophize an outcome of not being able to do something, we will increase our stress levels. So putting this into a practical example, if, for example, your house is a bit of a mess and you have a phone call saying that someone is coming to visit in an hour, and you know that that person is a judgy type of person and will criticise you for not having a tidy house. You also know that 1 hour is nowhere near enough to tidy the house. So you feel stress immediately. The level of stress you feel isn't based on how much of the tidying you can get done. The level of stress you feel is affected by what you think will happen if the house isn't tidy. If you think, Well, the old bag will have to judge me, but I'm not really bothered what she thinks. And I am in my head thinking of my ex-mother-in-law there. But if you think you're not really bothered what she thinks, your stress level will be less. If you think, OMG, she's going to think I'm an awful wife, parent, person, and tell everybody I can't cope and everyone will think badly of me, then you will have increased your stress levels. Now, using this idea of stress, Lazarus and Folkman then came up with 2 ideas for reducing stress: the problem-focused idea or the emotion-focused idea. Problem-focused means, can I resolve the problem of not meeting the demand by either changing something? I either reduce the demand or increase my ability to achieve it. Then the stress is reduced. If I can't change the demand or my ability to meet the demand, then I need to look about how I think about the stress. And this is the emotion-focused approach. Again, the more we catastrophize what will happen if we don't meet the demand, the more stressed we will be. If we're able to rationalize the possible outcomes, we are less stressed. If you can't change the problem, change how you think about it. Now, this is linked to other research which suggests that the best way of dealing with setbacks and failures and difficulties is to accept it, reframe it, and then try to laugh about it. If you can't change it, change how you think about it. And to be fair, this can be a challenge sometimes, but it does get easier the more you practice. Think about something that continually drives you up the wall, and it may be trivial. In fact, it might well be trivial. It may be something like someone at work does not wash their cup up, or someone at home doesn't hang their towels up to dry in the bathroom. I understand that this can drive you crazy every single time. You may have tried lots of techniques to get them to change, but it hasn't worked. And the worst thing is they actually aren't even that bothered about it. So let me ask you, who is the stupid one here? The one who really isn't bothered about it because it's not a priority for them, or the one who continually gets annoyed by it even though it's never going to change? There are 2 sayings here. The definition of madness is repeating the same behaviours over and over and expecting a different result. And by me expecting my children to hang up their towels, they're never going to get a different result, so I'm the stupid mad one. And then the other saying is that anger is a poison that only damages the vessel that carries it. Accept it, reframe it, laugh about it. Are they ever going to wash their cup up? No. So accept it and wash it up and then make a joke about it. Are they ever going to hang their towels up? Are my children ever going to hang their towels up? No. So I just hang them up myself. Yes, there is a principle potentially at stake, but look, do I do everything perfectly? Do you do everything perfectly? No, you probably do things that annoy others because we have different priorities. The only behaviour we can change is our own. Actually, as a sidebar here, that is why forgiveness is actually a selfish act. Remember what I said about anger poisoning the vessel that carries it? My first husband left me when our children were very small, and I was angry about that for a long time. I'm sure you're wondering why he left me, and yet I know, why would anybody leave me? But I hated him, and the hatred consumed me for a while. And then I realised he didn't care I was angry at him. He'd married some other ugly woman and was happy, well, for a while, because he did divorce her. But the only person the anger was hurting was me. So I accepted it and I forgave him. I reframed it, acknowledging that, yeah, I did have some part to play in the marriage breakdown, and also that I'm now far happier with my second husband. And as for humour, I think you've seen that a bit already. He's now on to his third ugly wife. Anyway, back to stress. So when you are stressed, follow the step-by-step procedure. Can I change the situation? Can I change the demand or my ability to meet the demand? Yes. Okay, I will do that. If I can't, then you rationalise your thought with regard to the outcome. Don't catastrophize. And this is really similar to one of the methods for managing anxiety. What am I worried will happen if I can't do this? What has happened before when I couldn't do it? Which is the most likely outcome of me not being able to do it? And what will I do if that happens? So with a visitor to the house that's not tidy, can I change the demand by just tidying one room and keeping it in there? If so, great, all sorted. I've changed the demand. But if not, what is the likely outcome of them visiting an unclean house, and what will I do? Come up with a plan. Maybe actually don't feel the need to come up with an excuse. Just admit that tidying the house isn't a priority. And then laugh. I laugh that I'm a terrible housewife. It's actually a stunning joke in my house. And then I show my mum, my sister, who laugh at me, an episode of Hoarders and point out that actually compared to Hoarders, my house is quite tidy. Part of being able to do this, accept, reframe and laugh, also links in with being proactive, supporting your mental health, which is in another video. Take some time to sit down and think about your stress. We can get stuck in a cycle of feeling stress, and we're so busy coping with stress, we don't make any changes, and so it continues. Think about what causes you stress continually and how you can deal with it. Can you change the situation, or do you need to change how you think about it? Being stressed long term doesn't increase our capacity, it reduces it. Another way to manage stress is to expect it, bizarre as that sounds, okay? But Albert Ellis is one of the people who developed cognitive behavioural therapy many years ago. And he said that often we cause ourselves unhappiness by telling ourselves that something must be a certain way. He calls them the 3 musts. And the 3 musts that we tell ourselves can increase our stress levels. Firstly, we tell ourselves that we have to be a certain way in order to be lovable. That if we don't achieve certain standards, physically, emotionally, financially, whatever, academically, and so on, that we are worthless. This means our stresses are caused by the demands we place on ourselves that we cannot meet. So part of reducing your stress is to reduce unrealistic demands you place on yourself. The second must we tell ourselves is that people must do the right thing or be punished. We become stressed if we perceive that people have got away with things we feel they should be punished for. This makes us angry. And then the third and final must is that we tell ourselves that the world must be easy, that my life should not have discomfort or inconvenience, which means that when things do go wrong, we increase our stresses with the why me thoughts. If we expect things to go wrong and expect things to be inconvenienced, then tell ourselves that we will be able to deal with it as arises, our stress levels will be reduced. I travel a lot for my job, and I no longer get stressed at traffic jams or late trains or planes. I used to be like, do you know who I am? I don't expect you to be late. But there's no point. It does all work out in the end, so I just go with the flow. And believe me, my life is less stressful as a result. Okay, so I've talked enough now, so let's summarise this. Looking after your mental and physical health proactively should be a priority, as it means that you will be able to manage stress more effectively. Being tired and run down automatically increases our stress levels because it changes how we see the world. Stress is part of life and we have to expect it. If you find your stress levels are becoming overwhelming, you can look at each demand and decide, can you manage the stress by either changing the problem or changing how you think about it. If it is changing how you think about it, then rationalise your thoughts, go through your thoughts on what are the actual possible outcomes and am I catastrophising here? Whatever happens, remember you will be okay and you are amazing. Thank you for listening.